So, run me through basically what happened.
So, whenever the quarantine came into effect, I was deemed an essential worker. We took steps to encourage social distancing. We sanitized surfaces regularly. We did the whole thing. But I still contracted the virus. I remember lying in my bed and I literally could not move. And I know it sounds crazy, but each night I literally hooked myself up to an oxygen tank because I was so fearful that I wouldn't wake up the next day.
So, when you told your employer that you had contracted the virus, what did they say?
When's as soon as you can be back?
This is Antioch, Tennessee, one of Nashville's biggest minority neighborhoods. What it also happens to be is the biggest hotspot of COVID-19 in the county. However, there appears to be more at play than just a random chance. Cities like Nashville convolute and underreport their racial data of positive cases for one reason or another, so it's hard to get a clear statistical picture there. However, in a partnership with Boston University and The Atlantic, one group is tracking this racial bias at a statewide level. As shown, this is the racial and ethnic breakdown for just the standard population of Tennessee. However, as we look at the racial data for confirmed cases, we see a scary reality. Minorities, especially Black and Hispanic communities, are clearly being affected at a completely disproportionate rate, and I can see that in my own neighborhood. Antioch is a prime example of this disparity, as it's home to the biggest Latino population in Nashville and one of the biggest Black populations here also. To find out part of the reason why this is happening, I sat down with one Latin resident who's been working amidst the pandemic.
My name is Jocelyn Valencia. I'm an insurance agent at Proseguros Insurance Agency. Our first day back, opening the office was honestly business as usual. Many of the customers questioned the plastics or why we had to wear masks. They didn't quite see the magnitude of the pandemic yet. It's not the news itself that's the problem, it's the lack of communication. The majority of the reason is because so many of the Hispanic community don't speak English. Along with this, many of them hold service jobs in the hotel industry, restaurant industry, housekeeping. We have many customers who work in gyms, cleaning. These jobs, they don't have the option to work from home on their computer.
Just the ability to quarantine is a privilege that many aren't afforded, and it's what's led to such a big outbreak in the community. As more data comes out, we see an increasing connection between infection rates and wealth. As you can see, there's clearly a correlation here. Why these communities of color tend to be poor is a whole nother discussion entirely, but it's what's causing these hotspots. Taking a break from work for weeks at a time isn't an option for a lot of people, so they're gonna go back to work regardless of the consequences. What applications like Zoom have done is allow for meetings and work to be done remotely. While this technology has definitely saved thousands of lives, the digital revolution has left a lot of people behind. This manual labor that many people in the community do is necessary for the rest of society to function, yet the people who do it are literally having to face a plague. As a society, we fail to protect them. Just a simple thing like providing better access to healthcare would save countless lives, yet the people who need it most have been forgotten. The healthcare system isn't made for those with a darker complexion. For many, being a person of color is quite literally a death sentence, more now than it ever has in the recent past. What this era has taught us is that change needs to happen, and it's going to take every individual to do so.